Hi, I'm Kristi Richards, and I started working with Dr. Cheryl about 8 months ago. I was suffering from severe mood swings, unable to get out of bed, unable to face the day. I had gained a lot of weight, and my husband was recommending that I go on antidepressants to try and help with my mood. And I refused to do that. I did not want to go down that path. And so I reached out to Dr. Cheryl and I would highly recommend Dr. Cheryl and her team because she is going to walk you through this journey. She's going to go hand in hand with you. It is not a death sentence because you are 50 and your hormones are out of whack. You can live a vivacious life, and it's not the end of the world whenever you're going through menopause. Before working with Dr. Cheryl, I was a personal trainer. I knew about nutrition, I knew about fitness, but in the past year, I had gained about 20 to 25 pounds. I had tried diets, I had tried going gluten-free, tried dairy-free. Obviously, I know about exercise, so I kept gaining weight with no explanation, and had all of my hormones tested and was on hormones by my general practitioner, and no positive results out of those other than massive mood swings and continuous weight gain. And so when I was about to buy a size 14 jean, and when my husband said, I think we need to see a doctor to get you on antidepressants, I said, nope, I'm not going to do either of those things. And so just kind of did some research on functional practitioners in my area, and that's how I found Dr. Cheryl. What made me say yes to Dr. Cheryl was I attended her hormone therapy class, and I have a very good friend who is a functional medicine practitioner, but she is not in my area, so she couldn't help me with my problems, and so she kept encouraging me to find a functional practitioner. So I attended the class, and just something about the questions that she had that I was able to answer, yes, that's me, yes, that's me, yes, that's me, made me say, look, I have to make a commitment to this. And it was a huge commitment. I think if there was anything that would have prevented me from starting, it would have been the upfront cost. But ultimately, I knew that the cost of medicines and all the other things that I was going to have to do was going to be the same situation. So this way seemed like a healthier approach than taking a bunch of pills that may or may not really fix the problem, but may just mask the problem. I knew I just needed somebody that was going to help find the cause of the weight gain, the cause of the depression and anxiety and sleeplessness. And so I was willing to try anything because I was desperate. What surprised me the most about working with Dr. Cheryl is I had tried diet, I had tried exercise, I had tried multiple doctors, nutritionists, and she got to the root of the problem. I was about to buy a size 14 jean, and I am now wearing a size 2 jean, and that was in less than 6 months. I never thought I would see a size 2, which is my normal size because I'm very small in stature as it is. I never thought I would see back to my pre-baby weight. I recommend Dr. Cheryl because it really did change my life. I was many times not getting out of bed in the morning, and that was really hard as a parent, not being able to confront my kids because I was so afraid who they were going to see that day, what personality they were going to see that day. And I would say to the mama or the woman who's going through premenopause or menopause that it is not the end of the world, and you can have a happy life, and you can be fit, and you can eat the things you want to eat and still be happy.